Hello, and thank you for joining us for this week's Rise and Thrive with EHE Health, an interactive series where we discuss all things health together. My name is Jessie Leon Soto, and I am a clinic director for EHE Health. I've been with EHE Health for over 20 years. And today I am joined by our very own medical director, Dr. Safdar, who has also been with EHE for well over 20 years. Welcome, Dr. Safdar.
Thank you so much, Jessie. As Jessie mentioned, I've been with EHE for 20 years, seeing patients in the Houston office, doing what I love best, which is getting to know my patients, discuss with them their health risks and appropriate prevention and screening for their particular risk factors and age.
Thank you, Dr. Safdar. And as many of you may know, October is Breast Cancer Awareness Month. And what better way to kick off this month with our very own Dr. Safdar educating us on this topic. Dr. Safdar, is it true that breast cancer is the most diagnosed cancer other than skin cancer in women?
You're absolutely right, Jessie. In women, breast cancer is the #1 type of cancer right after skin cancer. And unfortunately, it's also the second leading cause of cancer-related deaths right after lung cancer. 1 in 8 women in the United States will be diagnosed with breast cancer in their lifetime. So that's why this topic is so important, because early detection means complete cure. And that's why we need to have an open conversation about this.
Thank you, Dr. Safdar. Very frightening statistics. So thank you so much for talking to us about this. If we can go into talking about what are some common myths about breast cancer?
Well, one of the most common I hear from my patients is, well, I don't have any family history of breast cancer, so I can't get it. And this is not true. 85% of breast cancers occur in women who do not have a family history of breast cancer. Another one I hear is alcohol intake is not linked to breast cancer. It definitely is. If you drink 2 or more alcoholic beverages in a day, that does put you at increased risk for breast cancer. I've never had kids, so I can't get breast cancer is another one. And the truth is that the more full-term pregnancies you have, the less chances you have of getting breast cancer. And if you've never had kids, unfortunately, that actually puts you at higher risk. The other one that I hear commonly is men can't get breast cancer. That's not true. They can get it. It's definitely a lot less common than in women. And a man has about a 1 in 1,000 lifetime risk of getting breast cancer. So not very common, but it does happen, and we need to be aware of it and raise awareness in our brothers, husbands, fathers, so they know to look for it.
Thank you so much, Dr. Safdar. That's very true. Dr. Safdar, can you talk to us a little bit about what are some risk factors of breast cancer?
Yeah, I usually divide these into 2. One is risk factor that you can't do anything about. For example, being a woman, women are higher cancer. If as we age, we become the older we get, the higher the risk of developing breast cancer. If there's a genetic mutation in the family, we've often heard of BRCA1 or 2, amongst others, that definitely increases your risk of developing breast cancer, as does family. If you have a family history of breast cancer. Some of the things we can impact, for example, if you're overweight, you're not exercising, we've discussed alcohol intake, limiting it, breastfeeding at least for a year if you can. Having not having children or having them later in life also increase your risk. Use of hormones in menopausal, when you use hormonal therapy for many years, that can increase your risk. Birth control can also slightly increase your risk compared to those women who don't use it. However, once you stop using it within a few years, your risk goes back to the same as someone who has not used it. Being overweight, particularly after menopause, increases your risk. If you have dense breast tissue, which you see on mammography, you're also at slightly higher risk. Race can also have an impact. So in African American women, they tend to be diagnosed with it at a younger age, and unfortunately, for various reasons, they're more likely to die of cancer. So very important for these women to start talking to their doctors earlier. And with alcohol, if you drink 2 or more drinks a day, you have a 20% higher risk than women who don't drink. So please, that's something we can easily cut back on.
Thank you, Dr. Safdar. And I know that you might have mentioned this already, but to summarize, how can one reduce the risk of getting breast cancer?
Be active, increase your physical activity, 150 minutes of exercise a week, lose weight, reduce your alcohol intake, and avoid or limit hormone use as much as possible.
Thank you, Dr. Safdar. And some of the questions that some of our women have is, what are some ways they can lower the risk of getting breast cancer if they are considered high risk?
That's a question. If you are high risk for genetic reasons or family history, what are the things you can do to help moderate that risk? You may need to increase the frequency of your screening instead of doing it annually. Your doctor may discuss adding other tests, such as either breast ultrasounds or MRIs, to increase the sensitivity. Medications can be used called chemoprevention, in which you take anti-cancer pills to reduce your risk. In some individuals who are extremely high risk, they may also elect to do mastectomy. In other words, completely remove both breasts. And a very famous example of someone who did this is Angelina Jolie.
Thank you, Dr. Safdar. And just moving on to another very popular question, what are some signs and symptoms of breast cancer?
I think the most common one women tend to find is a painless lump or thickening in the breast tissue. It just feels different. Watching for changes on the skin of the breast, such as dimpling. You know how you see an orange? It has the little dimpling in it, very similar to that. So looking for dimpling, puckering, redness, or scaling of the skin of the breast, or changes to the nipple. For example, redness, scaling, or a nipple that begins to turn inward. Those can be warning signs. New discharge nipple, whether it's bloody, clear, low, all of these findings should prompt a visit to your doctor for further evaluation.
Thank you so much, Dr. Safdar. And with all of the nuance that we've been experiencing in the health world, one of the most popular questions is, when and how do we screen for breast cancer?
There's a couple of elements here. Their national organizations vary slightly on when to start. The best option is once you turn age 40, start talking to your doctor about screening. Discuss your health risks, your family history, and discuss the advantages and disadvantages of doing a mammogram. Make a shared decision. And if you choose to delay it till 45, that's fine. If you choose to do it sooner at any age, the frequency of mammograms is every 1 to 2 years. And the mammogram is the standard for screening. If that is abnormal, or if you're at high risk, other forms of screening may be, other tests may be utilized, such as an MRI, sounds. Your doctor may also use your information about family history, age, etc., and put it into some risk assessment tools, which can help estimate your lifetime risk of breast cancer, can also guide us towards appropriate screening and timing of screening.
Thank you, Dr. Safdar. And another popular question that we receive from our patients is, what's the best time to get a screening mammogram?
You know, the best time is usually a week or two after the end of your menstrual cycle. If you can schedule one at that time, that your breasts are less tender, there's less swelling, so it's easier to do this, and less false positives or abnormals. The other thing to keep in mind is, as we all hopefully are getting vaccinated against COVID-19, the COVID-19 vaccines can cause enlargement of lymph nodes in your armpit. And if you have a mammogram at that time, it will show this and will be considered abnormal. So the best time is before you start getting your COVID-19 vaccines, or you wait for 4 to 6 weeks after you've completed the series of the vaccines. And that's the best time to do it.
Thank you, Dr. Safdar. And if we can move on to another topic, can you speak a little bit about breast cancer awareness in the LGBTQ plus population?
Thank you so much for that question, Jessie, because these individuals often have limited access to medical care, and along with the health disparities there, pride discrimination, along with negative experiences with healthcare providers or facilities, really further dissuades them from going in to get medical and preventive care. And these individuals are at higher risk for breast cancer. In lesbian, gay, and bisexual women, they are higher risk. And for individuals who are transgender, the use of hormones to aid in transition does also increase the risk for cancer, breast cancer. And so we really need to educate this community, as well as educate ourselves, so we can reach out to friends or colleagues who are in this within this community to encourage them to get screened and get the care that they need. You know, and at EHE, you know, we do an mammography as part of our exam, and we welcome everyone to our program for prevention and screening.
Thank you, Dr. Safdar. Very important to get that annual physical exam and get the mammogram if that's what we have to do. Thank you so much for that. So just to conclude then, Dr. Safdar, do you want to reiterate any screening guidelines, any final tips, just to summarize our talk today?
Absolutely. Prevention and early screening. Get those mammograms. The sooner you find it, if it's found, the better the outcomes, the less the interventions you need. Encourage your friends and colleagues to go out and do it. Unfortunately, with the COVID pandemic, many women have not been getting their screening exams, and it's anticipated that with the drop in screening over the past year of screening mammograms, there was an anticipated increase in the diagnosis of breast cancer in the coming decade. So please go get it. healthcare facilities are actually much safer than going out to the grocery store because they pay particular attention to sanitization. And please go get your mammograms.
Thank you so much, Dr. Safdar. And just to let you know, I'm scheduled for mine next week.
Wonderful. And I had mine last year during the pandemic, so didn't let it slide.
Thank you so much. And with that, be sure everyone to tune in to next week's episode of Rise and Thrive with EHE. Thank you so much, Dr. Safdar, for speaking to us about breast cancer awareness.
Thank you.
Thank you, everyone.
Thank you, everyone. Bye.
Bye-bye.